everyone! Today we are going to talk about adrenal gland. Have you ever thought what is the gland responsible for the secretion of cortisol? This is the adrenal gland, and your body has two adrenal glands positioned above the kidney that secrete several key hormones for your body's vital processes. The adrenal gland is considered an endocrine gland, which means that its function involves the production of certain hormones in your body. The adrenal gland is responsible for many functions related to a wide range of hormones, which make any disorder in it play a role in many diseases and symptoms. After watching this video, you will have enough information about the adrenal gland, its function, and common diseases affecting it. Our role today is to answer most of your questions regarding adrenal gland. Today we have Dr. Kim, who is a leading doctor at the Catholic University of Korea, Seoul St. Hospital. He's going to discuss with us everything about adrenal gland from an experienced medical point of view. Hello, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good morning, Dr. Kim.
Yeah.
Very nice to meet you.
Nice to meet you.
Can you please introduce yourself to us?
My name is Kwang-Soo Kim, a surgeon in the endocrine surgery of the thyroid at the Catholic University Seoul St. Hospital.
Okay, straight to the first question. So, Dr. Kim, what is adrenal glands and where are they located?
The adrenal glands are organs located above the kidneys. The belly can be divided into abdominal and retroperitoneum, and the adrenal glands are known as the endocrine organs located in the retroperitoneum. It's located on both sides, and the left side is half-moon shaped and the right side is slightly pressed by the liver. So it's shaped like a triangle.
It's about 3 to 6 grams in size, so it's very small.
So why is the role of those glands very important in our body?
There are many endocrine organs in our body, including thyroid pancreas, and adrenal glands are known as one of the endocrine organs that secrete hormones. Hormones from the adrenal glands play a very important role in maintaining the psychological function of our bodies, but also maintaining the homeostasis of our bodies.
What kind of hormones are produced by the adrenal glands?
There are more than 10 hormones from the adrenal glands. Let me explain 3 of them as representative. The first is glycolytic steroids, called cortisol. The second is aldosterone, that controls blood pressure. And the last is catecholamine, released when a person is excited.
So what disease can occur with an excess of or lack of adrenal glands?
The disease that occurs when hormones are not released from the adrenal glands is called adrenal dysfunction. In other words, it's called the Edison disease. This is very rare, and the causes of the outbreak vary greatly. Diseases that produce a lot of adrenal hormones include Cushing syndrome, that releases a lot of glycemic steroids, hyperaldosteronism, that secrete a lot of aldosterone, and brown cell disease, that secrete a lot of catecholamine.
So are there any symptoms for the Cushing disease that you just talked about?
There are many symptoms. Some can be seen through blood tests, but some can be seen by appearance. Most of the representative symptoms that can be seen from the appearance are fat accumulation. Fat accumulation in the core can cause obesity, can cause fat accumulation in the face, or buffalo humps in the back of the neck. On the other hand, excessive secretion of the glycolytic steroids causes muscle decomposition. This can lead to weakness of the body, metabolic syndrome, diabetes, and endocardial disorders. Alternatively, the lipid decomposition may become abnormal and cause symptoms such as lipid metabolism.
Okay. So what kind of examinations are used for disorders in the production of adrenal glands?
Diagnosis can be divided into screening and confirmation tests. A screening test is a diagnostic method to determine whether it is the Cushing syndrome or not when a doctor suspects it. And a confirmation test is a confirmation that is the Cushing syndrome. When you do screening tests, since Cushing syndrome is a disease that increases the secretion of cortisol in the blood, the concentration of cortisol is measured, and the patient's urine is collected for 24 hours to examine the concentration of the cortisol. In this process, if the doctor suspects Cushing syndrome, the doctor will have a confirmation test. Confirmation test is called a low-capacity dexamethasone suppression test. At night, the patient is prescribed dexamethasone, steroids, and subsequently tested for inhibition of cortisol concentration. If the concentration is not suppressed at this time, it is confirmed to be Cushing syndrome.
So in the case of the Cushing disease, what treatments are done?
The treatment method for Cushing syndrome is surgery, because it is an operation to remove tumors that produce excess steroids. Patients should be prescribed steroids before and after surgery. Surgery is recently carried out through a laparoscope, because the adrenal gland is located behind the belly. It is performed with a retroperitoneal laparotomy, which reduces the patient's pain, shortens the hospitalization period, and patients don't need to fast. So patients are very satisfied.
How can we prevent the Cushing disease?
There's a known way to prevent Cushing syndrome. However, depending on the duration of the outbreak, the patient's symptoms, patient's appearance changes, and the metabolic syndrome can vary. Therefore, the best prevention is for the doctor to quickly suspect and diagnose the syndrome. Personally, I think it's a way to prevent this disease that doctors diagnose and operate quickly.
Today we learned so many things about adrenal glands, and the doctor explained in details everything related to this interesting topic. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.